My name is Tato. I think I've had pretty much all of you in a class before at this point. This is Zander, and Ryuujin is coming as well. So we are going to talk about injury management, and I want to make it abundantly clear, we are not doctors, right? We're athletes. I like to joke that I've had an honorary doctorate in physical therapy by merit of injuring virtually everything and then getting medical assistance for it, and they take you through the path to recovery. But that's the joke, right? So like, this isn't a class where I can like help you recover your injuries in the specific, but this is rather about meta skills and situations that you should think about when you're preparing to manage injuries. The first thing that I want to start with is like the injury stigma, and it makes me fucking nuts because it's so dumb, right? So like, there is this, and it's like an American societal thing. It's not like just an AmpGuard thing. There is this like belief that our bodies exist in perfect harmony with nature. If only we would use our bodies correctly and be in touch with nature and take perfect care of ourselves, then we would experience no health conditions whatsoever. And typically what this is from is people who have really good genetics. They don't have like hereditary conditions or joints and bone lengths that are like maybe not appropriate to specific elements of our supportive and athletic endeavors, or like people who just have like super fast metabolisms and can eat whatever they want, and they're like, well, I'm a embodiment of willpower and all that kind of stuff. That stuff is not true, right? Like, I want to make it abundantly clear that it's not a moral failing or a like lack of intelligence or diligence. A lot of the time when you get injured, you exist in a mortal body. You are trying to do a highly stressful thing with it. No, thank you. You had best get used to the idea that no one rides for free in life. Like, people get hurt. So what that means is, like, when someone is like, who is not a doctor or not a physical therapist, sometimes people, I think what they believe is that they're trying to exercise this element of control over themselves and their fate by engineering like this idea that they exist in like perfect harmony with the world, and they're doing everything right, and that's why they're not getting hurt, is because they're doing everything right. And if you're getting hurt, they're trying to mentally deny the idea that they could get hurt because they're doing everything right, so that they're not. So like, I'll give you an example, some examples about my own body that's like, are not things that I can control that result in injuries, right? So I have a second metatarsal in this foot. That's the foot bone. It's not the one that would be like your index finger. It's the middle one. It's slightly too long. And that destroyed my sesamoid, which is a pea-sized bone on the first metatarsal. And it's just the way that my foot is shaped and the extra pressure that angle creates that caused the cartilage to wear out from underneath that sesamoid. And there's nothing I could do to remove it. It had been trashed for years before it came out, but I experienced basically zero pain symptoms with that until it was ruined and had to come out. Unfortunately, it was something that I was like able to recover, but I remember being really frustrated when a lot of my friends were just like, oh, you're overtraining. And it's like, I want to be number one. Of course I am overtraining. Shut up. I will not stop doing that, right? Or like, oh, you didn't work on like this element of flexibility, or you didn't stretch enough, and it gets to really dumb stuff like, well, you should have like hydrated more or something. And at that point, it's just like, geez, dude. So what I want to get at is like, this class is about managing those things. Like, I can tell you some things that we think prevents injuries or mitigates them, but you can never know for sure. Your body just doesn't have a lot of sensation, and your ligaments and your tendons and your cartilage It just doesn't have that equipment until something is totally fucked and you don't really feel that coming. And a lot of the parts of your body are just these really complex systems where you don't always know like why you're having a problem, and you don't always have a problem. Like your immediate problem that is apparent to you is not always caused in the same location that hurts. So like, for example, I've been having a problem as I've been getting older. When I throw my shots, I hyperextend my elbows a lot, right? And I'm like, and through like what's a normal range of motion, and it just didn't make a lot of sense to me. And I tried targeting my triceps directly to like stretch them and strengthen them a little bit. I tried working on my forearms and stuff to help out. And when I worked with my PT, they did an assessment. I like, just think about this for a moment. I'm right-handed. I'm a weightlifter of 21 years. I think we decided in the class over there. I'm right-handed, fighting for 20 years. My right arm, the external rotation, like that, is 20% weaker than my left arm that holds my shield or my whiskey. And it's weaker than the arm that I'm like hours and hours and hours each day. So you tell me if I should have seen that coming. Like, probably not, right? So what I'm trying to get at is like, these systems are really complicated. If you get injured, it's not a moral failing. Everybody lives in a mortal body. Like, we don't belong in nature. Nature is very much trying to kill us every second of the day, right? So we're not these perfectly tuned engines or manufactured systems that's like, there's something wrong with it if it's not doing well. It's just that people have different experiences, different genetics, different structures in a complicated system, and sometimes you get wear and tear. And you will be lucky if you live long enough to get wear and tear. It's going to happen, right? So we want to recognize that and prepare ourselves for those situations ahead of time. So athletes, this is Ryuujin, by the way. So it just came up as one of the other co-instructors. Also, just to remind you guys, hard of hearing, it's a little bit quieter than I thought it would be over here, I think, because there's no whacking classes right now, so it's a little easier to hear for the moment. But just make sure that you get my visual attention. If you ask a question, I'll acknowledge that you have a question. I will finish my sentence and I will get to you. Same thing for you guys. If you have something to interject with personal experience, same protocol, just to make sure that I get to everybody. I'm not going to ignore anybody. All right, athletes have a positive, proactive coping mechanism to trouble. They begin the process of recovery before their losses and before their injuries. So the best athletes, and this is from a book that was like an aggregate of a lot of different research. I loved it. If you love like sports science stuff, and I suggest that you get started because it's very helpful for whack stuff and making sense of things. The book was The Best, How Elite Athletes Are Made. I forget the author's name off the top of my head, but great book that talks about lots of different stuff like injuries, mindsets, really interesting, different, even like teamwork strategy and stuff like that. It's just like a little notes about how elite athletes perform. Very good book. But they talk about, they view their injuries when they are injured as like not a disgrace, not a loss. It is their new competitive challenge, and they use it as an opportunity to develop athletic strengths and skills, and by mobilizing their social support networks. They have a different response to injury. They view it as an obstacle to overcome rather than a permanent problem. Some athletes experience some great benefits from injuries, so they can develop things like greater technical awareness, improved technique, improved strength and conditioning or flexibility. Like elite athletes will have to take time away from like their sport and do extra supplementary work that improves their overall conditioning and their strength or different elements of that. So I'll give you guys an example. I'm sure y'all have one. So the classic one is you get tennis elbow in your right arm, you practice lefty. That's like how everyone gets good at Florentine, because nobody actually likes Florentine. We like to whip up on people with board, which is our best combo because it is the best combo, right? So no one works on their offhand until their right hand is trashed. And I've had knee and foot injuries where I'll do, if you were in the drills class, so long as your body can tolerate the movement, I do standing, block strike, and things like that to just keep my hands from decaying, or even to like increase my speed and proficiency with my hands while my legs and ankles are recovering. And it keeps me invested in my sport and keeps me connected to my social work, while the social group, while they we basically continue to train. I felt like the best that I ever was in 2016, and I was doing a lot of heavy plyometric work, and I had ankle tendonitis and a very willing training partner, and we met twice a week. We did a ton of hands-only drills, and then by the time I recovered from that tendonitis, because I got involved with a physical therapist, I lost a little endurance, basically no strength. It came back right away, and my hands were the best that they've ever been. Like, sometimes you can have great benefits from those kinds of things if you plan appropriately. Do you guys have an experience like that?
Yeah, so in 2008, I suffered an injury to the lower half of my body that basically decimated my whole right leg. Ankle, knee, hip. Hip is still displaced to this day, and as part of my physical therapy, they had me doing a lot of mobility and a lot of strength building around that area, and I kind of adapted that into the sport. So my fighting style changed a lot. I used to be very like straight up and down, not a whole lot of footwork, but having to do the mobility drills on an almost daily basis, having to build that strength up, it gave me more positioning to learn how to throw things like, oh, if I change the plane, well, now I'm adding a lot to my fighting repertoire by adding things that I have to do to maintain the physicality in my lower half now. So I basically turned what would have been a very bad thing into the opportunity to change the way that I fight completely in an overall better way.
I think it's a great example of developing tactical advantages for the injuries. Do you have experience like that, Ryuujin?
Yeah, I'm naturally left-handed. Around the time I got my warlord with my right hand and was fighting almost exclusively with that. Due to a work accident, I ended up having to get one of my fingers reattached, and so...
Sorry.
So I was stuck not only fighting left-handed, but I couldn't do the supplementary work of having an offhand block to cover my shoulder or cover my torso. So I researched a lot of traditional saber fighting and worked on making sure that whenever I threw an attack, I had a solid guard from there and doing all my defensive and offensive work with my sword. And that really helped my single sword game go through the roof.
Okay, does anyone else have an experience like that? It's okay if you don't. That's why we're here learning this stuff. Yeah, what do you got?
In example, I'm in the middle of 1 foot into double reconstructive foot surgery. This is an opportunity to completely actually learn footwork properly. So I'm gonna have to learn footwork from the ground up. Well, I can do it right this time.
Yeah, I have an injury to my shoulder and elbow, and yeah, basically left side is not good, and knowing I don't have the great range of motion, range of movement on that arm means that I focus a lot more on improving my footwork, so I can get out of places that I know my arm cannot get out of quickly enough.
Good examples. Good examples. Okay, so we're going to talk about most of what we're concerned with is going to be repetitive stress injuries. So like there's a number of types of injuries, but the most common one that fighters face is repetitive stress. That's the one where you have to exercise more caution because it's just not always clear that something's wrong. Until it's very, very wrong. That's the confusing one. I feel like other major injuries, like having to have your fingers reattached, is like the path forward is relatively clear because your fingers are like on the ground or someplace horrifying, right? So the repetitive stress injuries are going to be what we focus on, but we'll cover the other injuries and protocols to work with them too. So we want to talk about how do injuries happen. So you can have like a genetic predisposition to things, like you can have certain syndromes that are like hypermobility or metabolic things that like make you recover slowly or predispose you to hyperextensions, things like that. So that's one. The more common injuries typically come from four factors. And I think there's one big one. And I think the first three factors influence the fourth factor a lot. So factor one is tightness. So if you are missing range of motion, it's a lot like driving a car without oil in it. Like, yeah, it'll work, but it typically won't work for very long, and it tends to run into its maximum range of motion, which is like less capable of sustaining stress, and that tends to cause some injury. There's weakness. So a lot of people, when they tear like their ACL, MCL, PCL, sometimes they have just like a weakness in their adductors or their abductors, like their groin or their glutes or their hamstring that they like maybe weren't perfectly aware of. And when you land with some force, sometimes if you don't have like a strong glutes that'll pull your knee out like this, your knee can cape inward like this and try to land this way, as your body's kind of hunting for stability and hunting for strength. So you kind of tighten down like this, but it puts a lot of strain through that ACL, and you can get tendonitis or ruptures or tears of the ACL through like that kind of motion. So that's an example of it coming from weakness. It comes from tightness that way too, right? Because like if your hips are stiff and you can't open them up, you can't take this protective position when you lunge when your knee is like a tiny bit this way. If you're too tight to spread your legs out like that, you can hunt for stability by turning that knee again because you just can't open your legs enough. And then the biggest, there's also like instability, which is kind of a combination of tightness and weakness, where you're like, your movements are a little bit chaotic and it's hitting the end ranges of motion that it's not strong enough or flexible enough to deal with because you don't have that stability. And there's also overuse. So overuse is the big one. You can do some pretty awful things to your body and get away with it. You can take your IT band, which is like a big tendon in your thigh, and if you cut it out, you can hang a car from that tendon and it won't tear, right? So you can do some horrifying things to that, but through the overuse and the repetition, it can break that tendon down and cause irritation to it, right? So it's usually overuse is the things that cause these kinds of injuries more so than like one big bang a lot of the time. That's the repetitive stress injury area. Things like obviously someone can like fall into your leg the wrong way and destroy it like on random happenstance, but those are pretty typically clear and somewhat unpreventable injuries. So we're talking more about the ones that we can prevent if we can. So there are 3 common injury approaches. I want you to think about which one you are. There is the zealot, right? They try to power through their injuries and hope that their body's ability to heal will catch up to their training load. So the problem with this is, LOL, said the scorpion, LMAO. You guys know that meme, right? Where the scorpion and the frog is swimming through the creek and the scorpion's on its back. And it's like, don't sting me. And the scorpion's like, oh well, and it does it instead of like the philosophical, it is my nature thing. Okay, no one knows that meme. Do you know that meme?
I know that meme.
Okay.
I know the meme and the story.
Wow, for me. That's close. Good. All right. So your body can't do that. A lot of times people will like throw a brace on something that is a developing repetitive stress injury and then not decrease their training load. And that helps for a little bit because it reduces the amount of overuse, but that will catch up to them eventually too, and it'll be like even worse, right?
I am some people.
Method number 2 is the Boy Scout. When they have pain, they try to not use the affected limb at all until the pain is completely gone. The problem with that approach is that over-resting a limb makes it tighter and weaker, and it decreases the total load that it's capable of handling. Without scaling up intelligently, basically what happens is the ceiling of total load that the affected tendon is capable of dealing with, because it gets hurt, we stop using it, and the injury itself weakens whatever part of your body a little bit, right? And if you rest too long, it gets tighter and weaker and more prone to injury. So when you're like, okay, the inflammation is gone, but now you've lost a lot of strength and you've lost a lot of range of motion, and you try to hit that ceiling again, and the ceiling's lower, and then you wait too long without using it, it gets tighter and weaker again, like down into the abyss of like chronic re-injury. So the third way, I think, is the optimal method for dealing with injury, where we are shooting for a more informed, the key point, informed mix of allowing for adequate rest to reduce that inflammation and working within our body's limitations to extend that ceiling until healing is achieved and we're able to return to sport at our full capacity. So we talked a little bit about this already. Identifying injury is really hard, especially for repetitive stress injuries, because again, your nervous system just doesn't really care about it doesn't really care about your tendons and your cartilage or your bursa, which are like pads that slide from bone between bones, until they're like really fucked, right? Like your body, it's paying more attention to like, am I gonna run out of oxygen if I'm exercising for too long, and more immediate needs, or like, can my muscles move again? But your joints are kind of just like, your body operates with the understanding that that stuff is fine until it's like absolutely trashed. So it can be difficult to distinguish between like what is just like some lingering stiffness that's normal for athletics, or some just like random twinges or pains, and what is like a budding repetitive stress injury or tendonitis. So the types of injuries, we're just going to go over the ones that are common. I know this isn't every type. This is just the type that I feel comfortable explaining and having somewhat of a resolution for. Again, I'm not a doctor. The whole point of this is more like, when you have pain or an injury, what professional do you see, and how do you talk to them to recover from it, and how do you interface with those professionals to find that stuff, right? Like, sometimes I feel like warlords are like very confident men, and we are trying to think that we like know everything, and then we make some really stupid conclusions on like how smart we are based on being really good at one thing. And we're like, yes, I'm a warlord. I won 5 kingdom level tournaments. That makes me smart as a guy who spent 10 years in residency in medical school and knows how to work an MRI and understands how they work, right? So we want to take these kind of like notes about these injury types and have some basic playbooks for like, how do we begin to address those with the help of a professional. So the first type is real clear: breaks, sprains, contusions. It's usually that's like bruises or like broken bones or fractured bones and that kind of thing. It's usually visible in the affected limb, like you can see that it just like looks fucked up, like the big bruise, fingers on the floor, like legs broken, you know, it doesn't work at all, it really hurts, something sudden happened to it. They're usually really clear, and they usually, like sprains and contusions, they usually just require some rest, and you want to try to like move it to a degree of comfort that it doesn't like get stiff and messed up, but you want to just rest until that's better. And if you have a break, you need to go to the ER. Obviously, don't wait for that to go away. If you have a suspicion that it may be a break, or it just really sucks for more than like, if it continues to hurt for a long time after the event occurs, you should just go and figure it out in the ER, urgent care, or something like that. Breaks, you probably need a doctor, you know that. And any sprain or bruise that doesn't resolve within 2 weeks, you need to go to the doctor. The 2-week rule is really good for healing. Like 2 weeks is probably the maximum amount of time that you can go before something doesn't resolve on its own. Like if it's been 2 weeks and it's not better, it's not getting better without help. So that I like to wait about 2 weeks. So for tendon and muscle tears, let's see here. These are usually simpler to manage because the results are really clear. The limb just doesn't work for any period of time. It's like having a flat tire. It's like, yeah, that tire is flat. This is not going anywhere. If you have like a big tear, it's usually like a pop in the affected limb. If it's really unstable, like you feel like, oh my gosh, my knee is gonna like come out from under me, that's usually a tear. Recovery isn't always surgical for that, but it is very likely. Most knee tears require surgery. Most shoulder tears for your rotator cuff actually don't. What's weird is that a lot of people, I've had doctors and PTs tell me that a lot of people are walking around with a rotator cuff tear, just don't know it, because it just like doesn't affect them. It can be true for knees too sometimes. I have a torn meniscus in this knee, and like aside from the initial tear, it was minor, and it felt not minor because it was something called a Baker's cyst, where there was like a little fluid-filled pouch in my meniscus and it exploded, right? Just a little cyst exploded, so it filled my knee full of like fluid. I'm like, oh God, well, my career is over. I need to find a different hobby. And then I had a bunch of gin, and it was like fine-ish the next day. I went to the doctor, and he's like, is just a Baker cyst that burst, I think. Just give it 3 weeks. And it was like, after I rehabbed it, it was fine. And that was 11 years ago, and I don't have any pain in this knee. This knee is a different question, but this knee's great. For now, knock on wood, if someone near a tree would please. Thank you. You absolutely need medical advice to recover from those injuries, or you probably won't be back, so you need to go to a doctor for that. And then I think most of what I'm going to talk about is tendinitis or tendinosis. It's the injury that is the most confusing to resolve, in my opinion, because the amount of pain changes a lot that you're in, and it's hard to scale up and down without running into those upper limits. Tendinitis, there's a difference between tendinitis and tendinosis. Tendinitis is just the inflammation of a tendon from overuse, and what happens is your body sends in a bunch of fluids to try to just repair that damage, but the fluid is not draining from the tendon promptly, so the fluid accumulates and causes swelling, and that's why it feels bad. Tendinosis is the degeneration and breakdown due to failed healing of tendinitis, so that's when your tendon is like getting weaker and breaking down because the inflammation is either so great or has lasted so long that you're starting to like lose tendon tissue. So you usually go from like tendinitis into tendinosis territory if you continue to work that limb too much when you have tendinitis. The rehab is the same for both though. It's just like longer for tendinosis if you really trash it. So this is a requirement that I think is like, it feels really shitty to give because it's not like a just situation. Personally, I am very anti-capitalist. Your opinion matters on that. But the reality of the situation is you need good medical insurance if you're going to do a hobby where you're going to have to compete at a high level and accumulate injuries. Unfortunately, America is structured in a way that, like, if I wanted to run a country poorly as a joke, this is how it would work in healthcare, right? But you need that health insurance, because with health insurance, usually I expect to spend, when I have tendinitis and I need to recover, it's going to cost me, unfortunately, and this is over weeks, but it's going to cost me about $1,000 between getting the diagnosis and going through the physical therapy sessions, and it sucks and it makes me mad unless your insurance is like super good. But if you don't have that, for some reason, it costs like 10 times the amount. So the best thing that you can do for yourself in terms of injury management is move to Canada or get good medical insurance. I hate that. That's not fair. That's not how life should be. But like, this is the system that we live in. We didn't choose it, but it's something that you're going to need to do.
Just join the military. You get all the great health insurance.
What's up?
I said just join the military. You get all the great health insurance.
That comes with other problems.
It does. It does.
Yeah, just line up for the shootings, and then we'll take care of you. America. Okay.
Take care.
So what I want to present you guys with is an injury script. So like, you feel like, hey, something is messed up. What do I do? Because interfacing with doctors can be kind of scary. Doctors are like, I feel like, and this is my opinion, so if you know any doctors or you love them, like, that's okay. This is just my opinion and my statistical analysis from associating with a ton of them. Doctors are on some deep nerd shit, right? And they kind of view people's bodies like cars and can be kind of hard to talk to. And I really feel like medical education self-selects for people with low empathy, because the amount of training that they put doctors through, if you have empathy for yourself, you're gonna fail out of medical school. So I think it selects for people who aren't gonna understand that they're gonna be, if you go to a doctor with a poor script, and I've had this happen to me 100 times, I'm like, look, like, I'm top 10 in the world at this sport, I have an injury, I need help getting back, and I've had doctors say to me like, I think you should quit doing this, it keeps hurting you. And I'm like, you are a sports medicine doctor. What the fuck is your job, dude? Like, why do you think that I'm here? So it really helps to ameliorate some of that stress, to understand like what medical school kind of selects for low empathy people by merit of the requirements of being a doctor. Usually if you advocate for yourself very well, they're fine with it and will help you most of the time. Other elements of discrimination aside. And basically, like, if you have a script, it's going to help you with that anxiety of interfacing with them, and it's going to increase your likelihood of getting the attention that you need, not wasting your time, not wasting your money. So we're going to go through this script. So we want to strike a balance between being overly cautious versus overly bold with our bodies when we suspect that we've got a budding injury. So upon the initial injury, right, like your limb's not working, it's feeling hot. I feel like I can tell the difference really well between like muscle and joint soreness that's really general and like tendonitis, because I feel like tendonitis burns. Like it feels like heat instead of just like a dull soreness. It feels like a little like someone is pressing like a hot pan or something into the joint like very gently. It doesn't hurt to that degree that would hurt, but I feel like there is a sensation of like temperature. And that's how I know. I'm like, yeah, this is tendonitis for the millionth time. It may feel different for you. I don't think there's any science behind that, but you want to just kind of think about the injury and be like, well, what does this feel like? And try to describe the injury to yourself, because sometimes those keywords are important for when you're communicating with a doctor, where you're like, okay, they'll ask you questions like, is it a sharp pain? Is it a dull pain? They'll take you through like different motions, like does this hurt? Do you hurt in this position? There are tests for torn ACLs where if you stand on one foot and you can't rotate like that, you got a torn ACL, and they're really pretty sure. They'll still look at like an MRI to confirm. But if you can do that, they'll be like, oh no, you don't have a torn ACL, you'd fall on the ground if you did that. So, well, you would feel unstable. I don't think they would let you fall down. Yeah, just go to a different doctor if they do that. So you notice something feels strange. It's clearly not muscle soreness. You want to think about, when did it start? Was it hours after practice? Was it the day after practice? Was it mid-practice? Did it start hurting in the middle of practice? And I will give you a hint. If something starts hurting suspiciously during practice, you should stop immediately. Exercise has an analgesic effect where you feel less pain when your adrenaline increases, right? So you are essentially, it's not like quite ibuprofen, but when your adrenaline is up, you feel a lot less pain. So if you can feel pain through that adrenaline, you're in a lot of trouble, and you should probably stop.
Tato? I got one. So intense exercise, and especially stuff like what we do with the mental aspect of it, also raises the cortisol levels in your body, which has a very similar effect to that. As your cortisol dumps, it makes it harder for you to feel that pain. So if something starts hurting right in the middle of you training, that's because it's messed up.
Because it's very messed up. And yeah, that's exactly right. Cortisol does the same thing that adrenaline does in a lot of cases, where they have like a crossover effect. So there's literally two hormones that are telling you, please don't feel any pain, until it's absolutely trashed. Yeah. So you want to try to describe the pain: dull ache, sharp, burning. Burning is tendonitis for me. You want to talk about, when does it hurt? Does it hurt all the time? Does it just hurt in specific positions? Does it only hurt after practice for a day, 2 days, a week till it cools off? You want to try to make mental notes of what that feels like, because you're going to use all of those notes in your script with your doctor, and you're going to try to, we'll get to it, but you just build like an actual script that you would use to describe what you are feeling to the doctor in as clear terms as possible. So if you are feeling if you have what you suspect is an injury, this is my playbook, right? So the first thing you do is called a reactive deload, where you cut your practice time in half, right? When you return, you start at half volume, right? So if you got 2 practices for 2 hours, you're practicing twice a week for a total of 4 hours, you can go to one of those practices and you fight for half the time. And if you feel like that is acceptable, and you don't have any pain during practice at all, and no pain after practice that persists for longer until you go to bed and you wake up the next morning. Like if you have pain the next day that you are certain is not just like muscle soreness, you're in trouble. So that means that you're hurt. So this is just trying to like save us a little bit of money, so that we're not going to the doctor for a $400 MRI for every little ache and pain, right? So 2 weeks is a good length of time to rest. On the positive side, if you're from hypertrophy science, where you're trying to build muscle, 2 weeks is like the maximum amount of time that you can rest, and you will not lose any strength at all. Your brain will start to send more inhibition signals for motion, so you'll like feel weaker for a little bit until you start training again, and it'll feel like you're weaker, but that's really just your brain being like, I'm lazy, I don't want to do this, man. But after like the first practice or two, your strength will return to normal. So sometimes, especially like weightlifters will get super anxious for like any breaks at all, or I think fighters can get very anxious to take time away because like everyone's trying to, all of your competition is relative towards all of the other fighters in your area, and they're practicing, so it's really easy to be like, oh fuck, I'm missing practices, I'm getting further behind, I'm getting weaker, you know, my steps are gonna be shorter. And you have about 2 weeks, and when you come back from those 2 weeks, a lot of the time, your ability to improve is potentiated, and you can improve more faster for a short spurt because you're adequately rested, both physically and mentally. The 2 weeks is a very safe amount of time that's not going to impact your overall progression. So I like to use that two week margin. It's not better in 2 weeks, we go to the doctor. So we try to resume our practice at half intensity, half the number of sessions, half the length of time, or half the use of the limb. So like if you got like a tendonitis in your right arm and your left arm's fine, you're working lefty, and I just healed my tennis elbow, I'm not gonna like say, my arm is healed, I'm just gonna use this arm the whole time. You would do maybe like 30 minutes with your right arm, and then like an hour and a half with your left arm, if that's like something that you can build up to. And then slowly use the right arm more and more if it's cooperating you. Your pain's not, it's not hurting during fighter practice, or the pain is cooling down very quickly afterwards. So we monitor how the limb feels. The goal is to experience zero or diminishing pain during practice. Sometimes, and this is the thing that makes recovery so frustrating, is that there is a small level of pain that you have to push through to build strength, and your tendon's like never gonna get to zero, even though you're like, hey, like it's healed, it should, but it'll be like stiff. And some of that is like neurological, where your brain is like, oh gosh, don't use that. And it's only sometimes, but you want to get, but that pain should not be more than like a 2 out of 10. And when you start exercising and your adrenaline and cortisol starts increasing, that should diminish. It should feel better for being active, or at least stay the same. You would stop immediately if it begins to hurt more during practice. So if you're like, all right, my arm is like a 2 out of 10, I think I can give this a shot. And you go in your practice and you're hitting 3 and 4, stop immediately.
The only thing I have to add to that is if you ever find yourself in a position where you suffer from what's called chronic pain that just by virtue of standing and existing, you are going to be in pain because you've sustained a lot of damage, constantly check in with your doctor. There's ways that they can mitigate that pain. There's medications and stuff like that, and your doctor will let you know this is a safe pain for you to exist in and still do what you want to do. It's not going to go away. Just know that if it gets worse, you need to go and see your doctor again. So if you're ever in a position where you're living in chronic pain circumstances, get used to that and understand that you need to be very mindful of when that pain increases so that you're not causing more damage to your body.
That's fair. All right. So if you want to monitor the limb after practice, if it got worse or it didn't improve, LMAO, it's time to go to the doctor. So that's my transition. All right, going to the doctor. So when you have an injury, how do you normally feel about going to the doctor?
Fantastic.
What?
Fantastic. Because I know it's going to get solved.
Great. Yeah, I'm going to spend a lot of money on some dude who's probably going to tell me to lose weight by merit of like existing.
Yeah.
This is not my favorite. You guys, how do you feel about that? Good, bad, neutral?
I feel okay about it.
That's good.
I grew up going to the doctor, so like I had really good insurance because my dad was in the military.
That's great.
So
it's always important, like if you've got that position of privilege, to kind of like recognize the benefits, and that's one. My family was very medical as well. My father passed away when I was young, but he was an anesthesiologist. My mom was a nurse. My uncle is like he's like one of the top child neurologists for, I think it's epilepsy, and wrote like a textbook section on like child epilepsy. So I think just some of that mingling with doctors a lot, self-important bastards. Uncle Steve, you stay off YouTube. You're fussy, but I love you. That element makes it easier. And I think sometimes, like, in addition to like massive compensation, which elevates doctors' like position in the hierarchy. I don't like that, but that's the position we often associate like a level of like genius with and awe with doctors when they're kind of like just people and usually pretty nerdy people. That's a great point. I didn't think to talk about that, but I had the same experience with like since I talk to a lot of doctors, it's probably fairly easier for me to talk to them. I have a friend, Matt, who is an anesthesiologist. We go back and forth all the time and we talk about doctors. Stephanie tells me like doctor jokes and I laugh at them, and I think that makes going to the doctor easier, because like Matt is a real funny goofball, but it's like aware of his foibles in a way that makes going to a doctor a lot easier. So that's a good point. How did other people feel about going to the doctor?
Generally okay now that I'm an adult.
Yeah.
It wasn't okay, like, it's changed recently.
That's good.
It's more better now. I'd rather avoid it if I can, because it does cost money, but I now have a job with really good insurance.
Yeah. Requirement for athletics in some cases. All right, so just wanted to establish a baseline that there's like different levels of doctor anxiety. I have a friend who is a warlord, and she really struggled with just fear of going to the doctor, and she delayed getting her injuries taken care of until they were like very, very bad. Is one of the reasons that I kind of like helped to develop this script for seeking medical care, to just make that easier. And for me, I think it wasn't like that I was afraid of doctors while I was like experiencing my first major injuries, but I just kind of didn't understand how to communicate on their terms, which like I had to go in and out of some doctors who like just wanted to say like, you know, quit the sport, quit the thing that's hurting you, and I'm like, you don't understand, like I love this sport, I want to play it. So this is a general flow of like, you have an injury in your sport. So I'm going to give you a general flow of like what you do. Do not skip any steps to save money in this workflow, or you will waste a lot of money, and there's a reason for that. So number one, get an appointment with an orthopedic doctor / surgeon, preferably one that specializes in sports medicine. So if you live in a city, this is an area where you have a big advantage, because they have like all of these associations of orthopedic doctors and sports medicine people. When I had a foot injury, I did a lot of Googling, and I found a guy that works with the Maryland Terrapins, which is like a college football team, because football players get like turf toe a lot. And his name is Gregory Guyton, and he was like fantastic. He did a great job of assuaging my anxiety and telling me that like I was going to make a full recovery, and that one problem was serious, it was like recoverable, and he knew exactly what to do, was able to explain it in clear terms. I did show him a small video of fighting to try to show him the movements that I was doing, and Greg did a great job of not laughing, though I could see it on his face, but he still took me very seriously. I was very proud of him. I'm like, you almost made it, buddy, good job. But he was a great doctor. So you get an appointment with an orthopedic doctor or surgeon. This doesn't necessarily that you need surgery. It's that, and don't freak out that they're a surgeon. Nobody wants to cut you open for fun. It's very expensive. Sometimes people are afraid, like, if I go to a doctor, they're gonna tell me that I need surgery. Like, they don't just say you need surgery and abduct you and cart you back and slice you open, right? Like, you have some say in that. You can go and get like a second opinion. Yep.
To give an example of that, when I decided it was time to get my feet fixed, it's a birth defect. It took about 5 appointments to get to the actual surgeon, and every doctor was very, very insistent on, we'd like to try non-invasive interventions first. And it's like, well, okay, so I've tried in the past this. Oh, okay, 3 of our non-invasives are gone. Can we try this? Yeah, we can try it. No, it's not better. Okay, they had to I'm not going to say be pushed towards surgery, but it was very clear it was their last resort. They aren't trying to cut you open. They don't want to.
Yeah, like if they cut you open willy-nilly, like there's a huge liability risk involved, right? Where if you did like a surgery that didn't work, that's why they have to have insurance, is because sometimes people litigate in those situations. So that's a great point. So the reason that we go to an orthopedic surgeon specifically is they're going to take supporting imagery of the affected limb. They're going to take x-rays, MRIs, ultrasounds where appropriate, and they're going to write you a physical therapy prescription. I won't get into it, but you need that supporting imagery and you need that physical therapy prescription, because they're going to diagnose you with something more complicated than my knee hurts, my wrist hurts, my elbow hurts. They're going to say they've got I'm going to slaughter this with lateral epicondylitis, which is like tennis elbow, or medial epicondylitis, which is golfer's elbow, and that means something very specific to the physical therapist, as opposed to like I had a very general pain. The supporting imagery is important because until you have that, you don't know if you have like a full tear of the tendon or if you just have some tendonitis. Sometimes partial tears are recoverable and they don't need to staple it back together. Or if you have like a full tear, like they have to do surgery at that point, but you kind of need to know because it's not always readily apparent. So you need to request a physical therapy prescription. So I don't know if this is good advice, but this is my experience. They may suggest injections or painkillers to like keep you playing. And this is up to you. You guys are adults. I kind of recommend against that. I think that like steroid injections that get your inflammation down really quickly. I've heard that like repeatedly puncturing a tendon can weaken it over time, and the steroids will make you better, but it also doesn't, it gets rid of the inflammation, but it doesn't fix the system that caused the tendonitis to arise in the first place. I had an experience where I was trying to take an anti-inflammatory for my, I got my sesamoidectomy was misdiagnosed as just like turf toe, which is just like a general mashing of the toe that hurts. So I had a doctor give me some, give me like a anti-inflammatory and a painkiller. It was like, it wasn't like an opioid or anything, but it was like pretty strong. And I'm like, okay, like I want to keep on my shit and I'm just gonna focus on my lifting for right now and my block striking. And because I was on that anti-inflammatory, I didn't feel that I was getting tendonitis in the shoulder from the increase in load on lifting. And by the time that drug wore off, I was like, my arm wanted to fall off and slither across the room away from me. So I recommend, unless you have like a chronic condition, like Zander says, where you're like pain is unfortunately something you're going to have to deal with. If that's not the case and you think that you could recover with PT, I would try to not control that inflammation and control that pain with chemicals to try to like get you back on the field faster. Like I want you to really try to do like the physical therapy aspect so that you don't like accidentally hurt yourself in another way like I did. And that's maybe lower risk because you're probably not lifting and fighting at the same time like I am, but it is something that can happen.
So I've had tendonitis in both elbows. I've also pulled some of my calf muscle off the bone when I hyperextended on a lunge. When you have small pain that's starting to develop in your elbows, knees, shoulders, wherever, if you end up having to take any kind of painkiller to be able to fight, you're going to end up giving yourself more injuries because you're not going to feel the damage you're doing at that point. So if you're trying to still fight with an injury and trying to test the waters and build back from where that is, you need to be able to feel what you're doing and how that's responding to what you're doing. So at that point, taking anti-inflammatories or painkillers or anything like that should be for your recovery after you're fighting, but doing it before is really just going to set, and during your fighting, it's really going to set you up for injury.
I think that's a great point. One of the ways that I try to think about it is I try to avoid using painkilling for anything that's not just like a random headache, because my understanding, or at least the research that I've seen that like jives with me, or I'm not a doctor, is that like that inflammation is happening for a reason. that inflammation is your body trying to send nutrients and compounds and things to try to recover the injury. So if you interfere with that, you can be interfering with your body system that's like trying to heal you. It can potentially slow you down a little bit too. But it's like with tendonitis, it's like, I feel like it's more stressful than painful, because it's like, it usually doesn't hurt like constantly all the time. It's just like you can't play your sport. So it usually just doesn't require that. I think it's best to not use that unless it's something you need. And then you bring up a great point, because if you see an orthopedic sports medicine doctor, you have to make clear to them that you want physical therapy to address the root cause of the injury, because a lot of the times they'll come with the mindset, which is a good mindset for a sports medicine doctor. Okay, if they're taking you seriously, they're like, okay, they have a tournament and they need to compete in that tournament, so I'm going to give them the painkiller or the steroid to get them back on the field. And you got to kind of clarify that that's not actually what you want. You're more concerned about your longevity as an athlete. Like, we're not making money here. Like, don't blow something up to play in a specific tournament unless it's like incredibly important to you. I've done that. You know, I'm not telling anybody how to live their life. In retrospect, I don't think it was a smart thing for me to do, but like, just make sure that you're contemplating all of the costs of those decisions and communicate with your doctor clearly, so that you're not like filed into the wrong category. I think sometimes doctors suggest that to me because like I'm very muscular, and they assume that like, okay, this person is a serious athlete, so they must want to get back to this immediately, right? Because like, why would he walk in here with all this muscle if he wasn't serious about this? And I have to say, okay, no, slow down. Like, I don't need painkillers, I need PT, and I need to make sure that we're not going to like do something bad to this joint. So we're going to get into that, why you need imagery. So what you do after that, we've got our imagery, we've got our physical therapy prescription. So we take both of those to the physical therapist. So if you go straight to the PT with no diagnosis, what they're going to do is take your money and give you a very general routine that's not going to be targeted enough to help you, right? So it's going to cost you a good copay to go to that doctor and get that supported injury, but you got to look at it for the physical therapist prescription, the position. They don't know if you have a torn ACL if you go in there with knee pain. They don't know if it's tendonitis. So they have to give you a program that's scaled up to the highest risk factor to mitigate their liability. But when you have a prescription from a doctor and imagery, they're in a more comfortable position where they can give you a routine that's more targeted. So you'll waste thousands of dollars. Like, this is capitalism. Unfortunately, they will take their money. They need it to survive, or they'll die, like the rest of us. Just make sure that you get that diagnosis from that orthopedic sports medicine doctor and take that stuff to the PT. So the PT is going to do some really cool tests. They're going to test your strength and range of motion. They're going to assess your pain. They're going to give you a exercise routine and scale that routine and monitor your progress from week to week and help you get back to sport. So when you have tendonitis, it's usually like a 6 to 12 week process to recover from a moderate injury. If you think about that, that's a month and a half. Like, that's 2 months, 3 months. It's not really that long, right? So if you're worried about fighting in a specific tournament because you're going to miss it, like, there's a quarterly kingdom level tournament, you will be fine. Just go to PT, right? Just go do it. It's not as long as you think. And it's really stressful for me to be injured because I just love doing this, and it's also my socialization, but it's important to just take a step back. The timeline for just a PT for tendonitis is very, very short. Like, you're not going to lose progress. You're probably going to come back to your sport stronger, and you will likely also have addressed the method of injury, that it won't happen to you again, or is at least less likely. So, your relationship with your PT doctor. So we talked about how doctors can be intimidating. They're highly trained, they're always in a fucking hurry, and they frequently believe that they're geniuses and God's gift to society. You want to prepare what you want to say. You want to at least have when the pain started, precisely where the pain hurts, what it feels like, what makes it hurt worse, and what you've done so far to recover, right? So you want to go in and say, let me see if I can talk about my injury from my elbow, the way that I talked to my doctor. So I said, I am at practice and I hyperextended my elbow throwing a shot. I think the closest proxy to a sport that you're familiar with and this is like to my elbow and shoulder doctor, it's probably a motion that's like throwing a javelin. Where you turn your hand over as you extend, like a proxy for a wrap shot, or if you got something else, you could say, I think the closest motion to like a reverse wrap would be like, it's like throwing a discus, right? You can use another sport as a proxy to communicate with them. So I hyperextended 3 weeks ago. I practiced for 1 more week because it didn't seem to hurt that bad. I took 2 weeks to rest, realizing I injured myself. When I tried to resume practice and lifting this week, I attempted a tricep extension, trying to rebuild the mobility in the joint, and that seemed to really flare up my pain. So there's a 3-week timeline from I felt like it was hurt when I hyperextended it. I continued to practice for 1 week. I rested 2 weeks. I tried to resume my sport and it didn't work. And I got that very complex description to you guys in 2 minutes. That's what those dudes want. They want that. If you come in highly organized, they will treat you extremely well. Why? Because they get to take your money and they don't have to ask you a ton of questions, and they actually have time for good questions, right? So that's how you talk to your orthopedic doctor. The relationship is a lot more transactional than with your PT. Your PT is going to be spending a lot of time with you. They're going to be guiding you through exercises and using different healing methods. Like there's like a lot of scraping and massages and things for tendons that they tend to recommend and helping you gently stretch. But anyway, for orthopedic doctors, you want to just take the time to rehearse what you want to say, like it's a job interview where you're introducing yourself, and you will get great care for that. We talked about that. Compare the motions to a sport that they're familiar with. You can talk about like, oh, our footwork is probably more like boxing than fencing, for example. Just use a real world proxy so that they take the sport seriously, because obviously these guys are usually older, so they're going to have more stigma for our group than like someone younger might. I've also met some doctors who are just totally cool with that. I'm like, hey, like I was top 10 in the country in this sport and people are looking up to me and they need me back in shape, and some of the doctors have genuinely been like, hell yeah, like we're going to fix you up, right? So you want to make sure that you have a competent, confident, succinct description for your injury, what happened, etc. Yeah, really what you need from them is just the injury and the diagnosis of your injury and the imaging, right? That's really all you need from the orthopedic surgeon for this part of the process. So your relationship with your physical therapist is a little different. I love these guys. You're usually going to be spending a lot of time with them. They're usually a lot more personable because they know that, right? So they're going to be nice to you. I find PTs really fun. They're very knowledgeable. They're frequently athletes themselves previously, and they're also like damn dirty nerds, and it's adorable. They're like usually like the person who's like parents made them do athletics, but they weren't like the best football or baseball players, so they didn't get picked up. So they were like also very studious, but they liked sports, and they're like, well, I want to do a doctor program because my parents are like, you better do a doctor program, it's the only way to be worth anything. But they also like sports, so they have a really unique combination of interest and experience that's just fun. And it's very funny because they're often as a weightlifter, I have a strong knowledge of anatomy and tendons because I've heard every tendon on the human body, but I love getting them talking because like they get into like this deep nerd stuff about how the body works in a way that's like adorable, and they sometimes get embarrassed. Like this guy was like, shucks, well I think if you just like add isometrics to your workout, like it's nerdy, but when the tendon does this and this, that's the best range of tension time for like tendon remodeling. I'm like, no man, this is like really interesting, teach me all the things. I'm coming for you, doctorate. I'm writing all this stuff down to take your job, passing to ChatGPT, and then automate PT. But anyway, I love those guys, and they're not paid as well as MDs, so their motivation is usually more intrinsic than extrinsic, so it's easier to cultivate a relationship with them. So I really recommend taking the time to learn about the function of your body and the body part that's affected from your PT. Get interested in it. In addition to the workout that your PT gives you, they'll also assign you homework to do that's like a slightly smaller workout. That is not optional. They will act like it's optional to be polite to you, but it's really not. Tendons have poor blood flow, so you need to be continually active to force that blood flow back into that tendon. Do your PT homework. The best part of working with a physical therapist is a lot of the time they'll use some of their range of motion or strength analysis. Like they have like these little protractors where they'll give you like you have 80 degrees of shoulder extension above your head or something like that, or they told me that my external rotation was 20% weaker. It was like 32 pounds. I could do 32 pounds of pressure this way and 47 pounds of pressure like this way. They'll break it down to a number, and it's super interesting. They'll talk about what is that whistling noise?
Birds.
Birds. Okay. It sounds weird. My cochlear's like it's treating it like a car backfire and turning all of the sound. Yeah, it's weird. Cochlears are weird. We'll get into it. That's the next class. They'll frequently talk about the cause of the injury, and help you address it. Like my example about that shoulder external rotation being weaker on one side. They're not always right about why your injury occurred, but they'll typically give you some tips on. That's really distracting. They'll typically give you some tips on like reclaiming that mobility or strength that they think will help mitigate that injury from recurring, and that's the most important part. Because your tendons don't heal super well. I think your tendons are made of collagen, but when you mess up a tendon, it doesn't really replace it with collagen. It kind of replaces it with scar tissue, which is less supple, but the best that you're gonna get if you damage your tendons. And it can get basically as strong as your tendon was before, but it's never gonna be like perfect again, so you need to do that extra exercises pretty consistently after that. The other thing that I like to talk about is there are fads within physical therapy that you might want to not spend your money on. So like the exercises and stretches are critical, and they're not up for discussion. Like they work, but there's things like dry needling, where it's basically like an acupuncture, and there's some kinds of massage or like electrostim. They're kind of up in the air whether they help or not, and they're not going to hurt you. I think they genuinely don't help as much as just performing the routine. They probably help a little bit, but you want to talk to the front desk and figure out like, hey, is my electrostim costing me more money than it's worth? If I could just like, sometimes it's like an add-on package for that kind of stuff, because like they do have to make money, right? So it's up to you whether you need that or not. I am very privileged in that I'm a software engineer, so I have a lot of extra padding for my bank account where I can like do the extra things that are going to help me heal like 2 and 5% faster, because it's just like, no kids. Oh, I got my dog, so I got one kid and he's cute. So that's something that I will frequently do, and a lot of the times it's just ameliorating my own anxiety about recovery, but just take a look at some of the science for things like dry needling, electrostim. I'm trying to think of other stuff, and just see if you think that it's there or not, and then make that judgment before you like sign up for that immediately and say yes to everything. But you want the exercises and you want the stretching, and you definitely want the massage too. That's usually like included. And it varies from PT place to PT place. If you have a big chain of PT places, I go to the Jackson clinics, which is like a chain. They are more likely to try to sell you things that are like a little bit sketchy in terms of the science. But if you go to like a mom and pop's place that's like a specific doctor, it's not like the Jackson clinics, it's like Dr. Peters physical therapy, because Dr. Peters works there. They're less likely to sell you those like add-on packages and stuff. So you can keep cost-saving options in mind. You can usually go to physical therapy with the doctor between 1 and 3 times a week. So you might go to PT 3 times a week or more after a surgery. You might go twice a week if you have like a new injury that you're not familiar with, and you might go maybe 1 time a week when you've already like maxed out the routine for physical therapy and you don't feel like you need monitored that much, or if you've like had the injury before and you feel confident in your ability to rehab it. All right. How much more we got? Okay. We have to cut some content. We start at 1. Okay, we got about 20 minutes left.
Yeah.
So, we talk about that's basically how you talk to the doctors. Do you have any questions on that before we move on to other stuff? Any comments? Okay. So I think the most important thing to consider is how you spend your time away from the sport. Resting your mind and body has a huge impact on your gains. And it may be comforting to think of your period of healing as like a phase of potentiation, where like you're taking some time away from fighting to get hungry to fight again, right? Like when you're training over a period of 10 years, it's super easy to be like, you know, it's getting a little dry and repetitive. Like I'm having a hard time getting into it. And the act of like missing fighting and being anxious about your position in the pack as you're trying to compete, like that feels bad. But another way that you can reframe that emotion is like you are stockpiling motivation for when you get back to sport. And it's not that you're gonna practice harder than ever. You wanna get back up to your baseline patiently. But when your brain is excited about things, it learns faster, it sees more details, it asks more questions. So you will have like a burst of improvement after you rehab something. Usually when you rehab a tendon, you're very close to being as strong as you ever were, or stronger than ever if you're like not already lifting. So it could be an exciting time to fight. So the other piece is, let's see, we talked about that. The other question to ask yourself is, are there other aspects of your fitness that you can improve? If your elbow or shoulder is injured, can you do more cardio? If your lower body is injured, can you do more block strike? Can you do the standing portions of some of the drills that we've talked about in our drills class with a partner? There may be other parameters that you can work on that you haven't thought of. So you want to think about what you can do and see if you can continue improving, and just ask questions about what can I be working on. There's another piece that I think is like a really important meta skill. Plan some mental stimulation during your recovery, right? Like fighting is super exciting. It connects you to your social group, but you need to ask yourself like, well, I can't do this right now. What else can I do with my time? So I like to have plans that I'm gonna work on that aren't wax for myself. Like I keep a list of like side projects that I would like to do in software, like extra little programs or languages that I would like to learn. You can think about like, what are projects that I always wish that I could do that I couldn't find the time to do? Do you have an idea for a baller shield cover that's like a stained glass middle finger, which is like extremely popular out there, I guess? Or like a really cool tunic or something like that? Do you want to do like some A&S entries, or maybe work on a recruitment program for your park to like help the sport out, or organize some events? It's really helpful to just have, do you want to just write some fun fan fiction or something for something you like? Like just, you want to have like a basic plan for like, how am I going to keep my spirits up through my recovery? You laugh if you want. I think fan fiction's great. I don't yuck anybody's yum, man. It's great. Whatever makes people happy. Or like maybe you could think about like, if you're in IT or something, is there like a certification that you could get that might help you get more pay or something like that? It's a great time to do something like that. Like, no, it's not fun, but at least you have something to show for your time. Yeah, Jeff?
So along with the recovery, one thing you have to realize is proper sleep goes a long way towards how your body recovers. So if you go to the doctor and you're doing the PT and you're resting from sport and you're doing all of the things, if you're still staying up till 2 or 3 in the morning, clacking away playing video games and then getting an hour and a half, 2 hours of sleep and then going to work the next day, your body is not going to recover at any quick rate. So being able to like slow down and do things the proper way, get 8 hours of sleep a night, let your body have that time to rest and recover, you're going to recover exponentially faster than if you're doing all of the right things, but you're not allowing your body to actually rest and recover through good, proper sleep. So you have to be very mindful of that. If you have the habit of not allowing yourself to have a proper night's sleep, you're not going to recover quickly. So make sure that you're doing all of the things, PT, all of the stretching and exercises that your physical therapist is going to give you. Get good sleep. You're not going to recover if you're not letting your body get the sleep it needs to recover.
That is a fantastic point. That was not in the notes. Thank you for that. And I also think it ties into like keeping yourself mentally stimulated during your downtime. will help you sleep, because it helps expand a lot of the pent-up energy and ameliorate a lot of the anxiety that would keep you from sleeping. So let's see here. In terms of injury prevention, I want to talk about periodicity and loading. So periodicity just means like, if you were in the fitness class, we were talking about running like a mesocycle, which is a period of weeks that you train. This is the prevention category. A period of weeks that you train with scheduled rests. So those could be training periods of different lengths where you're like, okay, for 6 weeks, I'm gonna hit fighter practice twice a week. I'm gonna do lifting 2 to 3 times a week, and I'm gonna do 1 bonus cardio session on the elliptical. And you don't wanna, we're not like our existence is essentially very like circadian and rhythmic, where your body's gonna have like a certain level of energy that it can expend over a period of time, and then it's gonna need a period of time in recovery. And that's not just a daily phenomenon where you're awake for 16 hours and then you sleep for 8. That's also like a week to week thing. So if you're training really hard, you understand that you will need a period of recovery. So your mesocycle for your training, where you're training full tilt, you always want 1 pure recovery day where you're just doing like an active rest, which consists of just like nothing that's like training, but you want to move around. You may take a walk, do some gardening, some very small sets of very light calisthenics are okay. Just things that promote blood flow and help you keep your stress down so that you can continue to sleep. So always one day of one day off, or 1 day of like very, very light physical activity to recover. You need that. And then you can play with the length of a period of training where you're gonna say, hey, I'm gonna practice for 6 weeks, and then I'm gonna take 1 week and I'm gonna deload. And a deload is you take, you can take it off completely if you want to. If you don't like doing that, there is some research supporting that just doing a very reduced load is as good or better than resting completely, because it keeps your blood flow up, it keeps your brain from reducing what it believes is your level of strength, level of range of motion, and keeps you like at that level that you trained up to neurologically. So a deload is you take half the number of practice sessions, half the length of the practice session. So like if you fight twice a week for 2 hours at a time, you would fight once during the week for 1 hour, and that's it for the week. That's going to help you recover. And by automating that and saying every 7th week is a deload week, you can avoid a lot of injuries that way by just automatically taking some time to recuperate. You can play with the length of that period, whether it's 6 weeks and the only thing that you're doing is fighting, like you can do a longer period. For me, I lift in the morning, I do cardio at night, whether that's like on the elliptical, jump squats or practice. So I can only keep that up for 3 weeks before I start getting tired. So I deload every 4th week, and that's just what it takes for me. So don't just try to maintain the same level of training all the time. Just pick a length of time, about 6 weeks I think is real safe, and then take every 7th week off. If you feel like that 6th week you're getting like tight and stiff, reduce your period size down to like 5 weeks and just play with that, but make sure that you have some scheduled rest before you're hurt, like before you suspect that you have an injury, to just get those tissues back to just that homeostatic average where you're like, oh, this is what a body is supposed to feel like. I don't need to train all the time. That's what my knees and my shoulders are supposed to feel like. It's a great way of preventing injury. Yes?
Well, I suppose there's an adage to remember that, is that either you set a time to rest, or your body sets a time to rest for you in the form of an injury. Exactly.
You could think of injury as a form of your body auto-regulating your athletics by saying, no, that's too much. We're taking a break now. Now you're hurt. Right? So that's a great point. Thank you, Misty. All right. So there's some other elements of injury prevention that are helpful. I like strength training a lot. So the theory here is that increasing your strength will allow you to use less of your total capacity and strength while you are fighting, right? So if I'm throwing a shot, right, and I'm not very strong, but I needed to move at a reasonable clip, but I'm not I'm not a strong person. It's going to take 100% of my strength to throw that good rep shot and make good contact. But if I increase my strength, I can make convincing contact on someone when I throw that rep shot with a lower percentage of my strength. So it's the difference between like driving a beater car and a really powerful one. Now, if you buy like a Mustang or a Camaro and you're zooming around 120 miles an hour, you're a jerk, right? I hate that shit. But if you have like that Mustang or that Camaro that you've built up over time and you drive it like a sane person at or close to the speed limit, your car lasts a lot longer, right? Whereas like if you got a VW Beetle that your grandmother gave you and she bought it in the 70s, that sucker's only going 45 miles an hour tops, right? Or it's gonna break down. So strength training can really help you increase your capacity and prevent injury. Strength training can be injurious on its own if you're not careful about it, but that's something that you would worry about like more after a period of years of accumulating more strength. So for beginners, it's not going to be injurious unless you're like not ever resting or doing far too much. If you're interested in strength training, I would work with a personal trainer. I would not pull a program off the gram. You can check the fitness channel on the SKBC Discord, and I'm going to post some just basic beginner programs so you have an idea of like what volume to start with, and then you can scale up based on your interest from there. The other piece of injury prevention that I recommend is working on your mobility. Same theory as strength training. You want to make the demands of your sport, you want to increase your capacity such that the demands of your sport requires less of your overall total capacity. So a good example is if I want to lunge at Zander over here to hit him, if I'm very flexible, I can hit this bottom of this lunge safely, and my hips are open, my patellar tendon is strong. You can get your flexibility to a point where this is not going to hurt you. But if you aren't flexible and you try that, it will hurt you, right? So it's not necessarily bad to hit that range of motion if that's not your max range of motion. If that's your max, you don't want to throw yourself into that position. But if that's well within your capabilities, it's not injurious to do that. Does that make sense? So it's the same basic theory. Don't try to drive the VW Beetle 70 miles an hour on the highway. Slowly work your way up to better and better cars. And just build up your body, build up your flexibility, build up your strength. And that way that wax is like, the way that I like to think about it with my own personal training, whether it's like lifting or mobility, I do not want wax to be the hardest thing that I do, right? Like, I think that that's, the analogy doesn't work for like the duration that we play this game. Like, not a lot of athletes will play for like 8 hours a day for 3 or 4 days, and you can't really simulate that reasonably. I'm talking more in terms of intensity. Like, ideally, in a perfect world, if I was going to prevent injury, I would make sure that my maximum cardio capacity is above the requirements that a hard fight would take by as much as you can reasonably do that. Unfortunately, that also increases your capability of fighting even harder, so that can kind of race up a little bit, but that's the basic theory. Or like, I want my ability to throw a shot convincingly needs to be well below like the full strength that I'm capable of. So anyway, that's pretty much my presentation for you guys. Thanks for helping out with co-instruction. Do you have any questions for us? This is your time now. Any questions?
Yeah. You were going to post a general script of like the way to talk to the doctor online or somewhere.
I was planning on it, but I can't do that. That's a good
Cool.
idea.
Appreciate you.
I'll remember that. Anything else?
All right, so what I'm hearing is that between the three of us, we have articulated so perfectly how to manage injuries that you have a full grasp of that from this presentation, right? There's no questions out.
Questions.
I've received so much info, I'm not how to articulate what questions I have.
What's up?
My issue is I've received so much info, I'm not sure how to articulate the questions I have.
We got the video you can review, Steph.
Yeah,
when it goes
that's
up.
probably what I'll end up doing.
You got a question?
Yeah. I used to fight in DAG, and I did that for a solid 10 years. I took a lot of hard shots, punch blocking a lot of shots, so I still have residual issues in my hand, and I feel them when I'm fighting, but they don't last. I don't have them, like, it's not a constant thing, but like if I get into a certain torque, like trying to move into a wrap shot of any type, I can feel the tension throughout in my arm all over the place. And how do I know when it's tendonitis or tendinosis versus just a chronic injury?
So what I would do is take the exact description that you gave me. I'd go to a doctor and see if they can diagnose that for you. So I think we had to talk about it for a long time, and I could make some basic guesses, but the body is such a complicated system that it would be really hard for me to say, like, oh yeah, that's tendinosis. And also sometimes the categories for injuries are really nebulous, right? So there's an injury that you can get that's just called a stress reaction, where it's somewhere between, it's something that happens in your bones a lot, and it's somewhere between, I can't think of the name for it. It's a tiny fracture that's like not quite like a stress fracture.
Like a hairline? Hairline fracture?
A hairline fracture. It's like somewhere between a hairline fracture or a stress fracture, but it's like not quite there yet. But it's essentially like the bone is just irritated, and it's like a category of issues. So, or you could have like multiple issues, but you don't have to be like super fucked up to just go to the doctor. You can say, okay, so for example, if I had your issue, the way that I would describe it to a doctor is to say, hey, I participate in medieval combat sports, and we perform some motions where when we fight with these sticks, we perform some discus-like motions where we throw, which was just the motion that you were showing me. And some of the times, I feel like I'm reaching like a terminal range of motion, or it feels tight, or it feels poor. And while it does seem to be operating for me effectively, I still get a lot of pain, and I would like to be able to play as pain-free as possible or prevent further injuries. Can you get me a diagnosis and imaging so that I can work with a PT? Because like one of the complicated things that could happen, and why I don't like to guess what a person's injury is, well, maybe it's not your wrist. Like maybe you associate that injury with those impacts, but maybe your shoulder is just tight and your wrist is overcompensating for like a tight shoulder, and it's just throwing that pain down the chain. Like that's what happened with my elbow. It's like my elbow's not the problem. Like I bench, like elbows don't do anything that complicated. Like they extend, right? I bench 350, that's not the problem. The problem is my elbow is also trying to be my shoulder, so it's hyperextending by twisting apart. But the systems are complicated, right? So you need a doctor or a physical therapist to tell you that kind of stuff. But you don't have to be totally wrecked to go in. You can just say, I have this problem, articulate it clearly, see what they can do for you. If the doctor's an asshole, there's millions of doctors. Find a different one that'll help you.
There's also, just because you feel pain in a specific area, doesn't mean that's the actual cause of the pain. That's just where you're feeling the inflammation, and that's what the nerves is signaling. But like, I had damage to my tendon when I had my finger sewed back on, and when I was retraining a couple years after it happened, I noticed I was getting really severe pain on the inside of my elbow right here, and I was having it was just almost debilitating pain. And I wasn't sure if I had golfer's elbow or tendonitis. I hadn't had either of those before. Wasn't sure what they felt like. When I went to talk to the doctor, whenever I cut that tendon, when they reattached it, they shortened it. And so because of that, it hadn't stretched back to its full extent yet. It was small and tight. And so when I was gripping and I was shortening and tightening that, those tendons from your fingers go back and detach nearly at the elbow. So just because you're feeling that pain there doesn't mean it didn't have anything to do with my elbow. It had everything to do with the tendons in my hand. So it's really hard to diagnose without having the tools that a doctor has of being able to do x-rays or sonogram or anything like that. It's really hard for us to say like exactly what that could be. We could make guesses because we've all been through and felt that pain and felt different pains and had different injuries, but we could all agree that it would be like tendonitis or something like that, and you could try to start treating that on your own, but that may not be what it was, and that training may exacerbate the existing problem.
Fair enough.
Got this great answer. Other questions? Yeah.
With the reality of the American medical system that sometimes it takes a long time to get an appointment, or I'll just use an example for me. I have access to the UW medical system in Madison. It's an amazing system. It's an amazing system, and so everybody wants into it, and all the doctors are freaking booked. When you're told, oh, we can get you an appointment, but it's in a month.
Right.
Kind of what do you recommend to do in that interim when
I'm glad that you brought that up, because I cheat at what I do. As at the first sign of trouble where I think I might have to take a rest, I call the doctor and I don't actually wait 2 weeks. And I schedule an appointment for 2 weeks later for when I may not be healed yet, and I call and I cancel the appointment if I'm okay. They hate me. They hate me in the front desk. So that's how I manage that. That'll shorten up the wait a little bit, and that's a good point. It can take a lot of time to get care too.
Just
other questions?
Monthly appointments.
What do you think about using KT tape or like braces or anything like that to help prevent or manage injury?
Oh yeah, braces is a whole topic. I should have put that in my notes. Braces are for a couple of things. They're for chronic injuries that are not going to get better, and a little bit of extra support keeps it from flaring up. A brace can be helpful for after you have cleared PT if you're nervous about it, to kind of get an intermediate load where you're getting some support from the brace in hopes that you're going to be able to fight without the brace a little bit later. What braces are not for, that you're never for, is you have an injury and you're trying to train for 3 more weeks for a tournament later, and you slap the brace on hoping that the brace will support you enough and protect you enough, then you can either heal before the tournament or make it through the tournament. Just don't use braces for that. KT tape are basically just braces, but they work differently. They're not like they have like a adhesive component instead of like a Velcro and wire and stuff. So they're basically just braces. I wouldn't try to use KT tape as a replacement for PT or rest. Yeah.
Oh, stretching.
Okay. Other questions? Okay. Thank you very much. Appreciate it. Thanks for coming out.
Thanks for taking.
Yep. Thanks for coming, Jim. Yeah. Very helpful. Sincerely, Dr. Tates.
Sincerely what? Sincerely what?
Dr. Tates.
Oh,
Me, the doctor. I'm Dutch now. I just turned